Okay, so we are seeing a very, very good news right now. Pfizer, which is the company that actually was in fact, is the first company that actually broke ground in terms of a COVID-19 vaccine. So right now they are moving to the next stage, of trying to break another ground, which is to get a treatment for COVID-19, which is something everybody wants. I mean, everybody wants that. It's not something that you say some people don't want and some people don't, want. This is something that everybody wants because COVID-19 has actually affected and impacted our lives in a very negative way. So Pfizer is actually now working on something, and the next thing they are working on is actually a pill, an oral pill, which is going to be like the first oral antiviral treatment of its kind for coronavirus. So this is a groundbreaking experiment, a groundbreaking discovery, and we hope that it actually works. Though right now they are in the trial stage, which is like the first trial stage. These are before you get these things approved, you have to go through different stages. Try the first trial, second trial, third trial, just to so as to ensure that those the drugs or whatever they are going to put out there is going to be safe for the people and not just some concussion that is going to affect people in a negative way. So right now, they actually, the trial is being conducted in the U.S. alone, and it relies on protease inhibitors. This same kind of which is the kind of technology that is used to treat HIV and hepatitis C. So that is what is happening right now. So the trial is randomized and includes placebo groups. And this placebo group means that some people will be given the drugs, the pills. Right now it comes in form of pills. Some people will be given that, and some people will be given the pill that doesn't contain anything. That is placebo. Placebo means there's nothing there, maybe it's just a sugar or something like that. There's nothing there, but just to know if there's a difference between the drug and the placebo. So those that took the placebo are going to say, okay, that they are going to be studied, and those that took the drugs are also going to be studied. So based on what is gotten, so those that took the placebo are going to be like those that are just normal. But meanwhile, they will still be tested and see if they are, anything happens. That one has to do with their, their internal beliefs and what they tell themselves. If they think it's a drug, they might think it's healing them, that they may be healed. So that is what is happening right now. And the company is actually studying also something again, which is an intravenous antiviral treatment also for COVID-19. So that one is also going through clinical trial, for hospitalized patients. So those that actually have the COVID-19 already now are actually being tested with that one. So that one is going to be like, normal intravenous drug, which is going to be like a shot giving you an injection, while the first one is giving you a pill to take just like a normal tablet. So the one for the intravenous is actually being tested on those that actually have COVID-19 currently. So they are going to be tested and then see how it works. Of course, there's going to be some agreement of those who want to be tested with that. But when you're actually fighting for your life and you don't know what is going to save you, you want to try anything you have or anything that's available. So I know a lot of people actually, sign on to be tested, of which it might not be safe yet because it's still a new discovery, still in trial process. But people will still sign up because, I mean, what's the chance, what's the possibility that you're going to survive it anyway? So why not just test it with the drug if it's going to work fine? So currently, right now, the only vaccination and therapeutic treatment that could be the way, to return to normal activity, the only FDA approved antiviral treatment to COVID-19 is actually the Gilead's, remdesivir therapy. But clinical studies have shown that the drug isn't highly effective in treating COVID-19. Rather, it can block the COVID-19 from replicating in the body. So that's the only FDA approved drug for COVID-19. But even the one that is approved so far right now, it's not as if it's going to treat COVID-19, but it's going to stop the virus from actually replicating in someone's system. So it's going to like halt the process, more like what you have in the antiretroviral, what they call it, the one for HIV as well. It's not as if it's going to treat you, it's going to take out the HIV. No, it might just stop the process of it replicating in your system. So that is what they have. But when this one for Pfizer works, it's supposed to be a real treatment. So everyone is actually banking on that and hoping that it works. And we'll share more detail when we get more detail about that. But hopefully it does work. It's going to be a very, very big, groundbreaking achievement. And we can actually return back to normal where we have a drug for this COVID-19. So that is what I actually want to put out on this, and I hope you find it informative. Give this video a thumbs up. Thank you.